Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2018, 2022, and current clinical trials. In the last several episodes we came back to the Cognoscopy. Dr. Bredesen's evaluation is screened for all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. We specifically talked about that first genetics test Dr. Bredesen wants us to complete and the ApoE4 gene. Next up, we're getting into an important lab marker called hs-CRP. Okay, what is hs-CRP? hs-CRP stands for high sensitivity C-reactive protein. Okay, so what is that? High sensitivity C-reactive protein is a blood lab test to pick up levels of C-reactive protein in the body, which is a protein that our liver produces when we have high levels of acute or chronic systemic inflammation. The higher the C-reactive protein, or CRP level, the more inflammation we have, so the lower the better. Higher levels of CRP can be used to detect cardiovascular disease up to 10 years in advance because sustained elevated CRP levels that aren't coming down typically indicate chronic inflammation, especially in the circulatory system. Studies show elevated levels of CRP are strongly associated with heart disease, increased risk of heart attacks, strokes, and dementia. Studies also show that Alzheimer's patients with higher CRP levels cognitively decline faster than those with lower levels. This is a protein that the liver produces as a messenger, and the messenger is screaming out, this inflammation must be resolved. This fire must be put out so the tissue breakdown can end and the repair process can begin. So to put out the fire, lower that inflammation, and get our CRP levels down, we need to identify the sources of our inflammatory response. Well, what are they? Like we talked about in episode 25, Dr. Bredesen has seen that there's often more than just one source, but here have been the common offenders Bredesen's team have repeatedly seen trigger inflammation and drive cognitive decline in patients. Leaky gut, diets high in simple carbohydrates and sugar, trans fats, chronic infections like Lyme disease, other tick-borne infections like Babesia and Bartonella, viral infections like herpes simplex and Epstein-Barr, fungal infections like Candida, mold infections from Aspergillus and Penicillium that can grow in our water-damaged homes and buildings, parasitic infections like Giardia, and bacterial infections like P. gingivalis in our mouths, H. pylori in our stomachs, and Clostridia in our guts, and more. Many of these chronic infections can fly under the radar and not really be picked up by standard lab tests for years. They can start out as this low-grade inflammation that's quietly in the background, and we can grow to tolerate it without noticing too much. As the years go on, these infections rob us of our vitality and essential nutrients, inducing cognitive decline. Aside from infections, the other biggest contributor to systemic inflammation is what we feed ourselves every day. Please watch episode 16 for a brief overview of Dr. Bredesen's anti-Alzheimer's diet, which is his research-based dietary program that promotes insulin sensitivity, minimizes inflammation, reduces obesity, improves cardiovascular status, helps optimize hormonal response, and improves cognition. Is that all? Apart from treating and eliminating infections and optimizing the diet, other powerful tools Dr. Bredesen has employed in helping resolve inflammation have been SPMs, omega-3 essential fatty acids, the most important of the three being DHA, and curcumin, the potent polyphenol found in turmeric, to name a few. I've linked a paper in the description below of an analysis of 32 studies showing the supplementation of curcumin significantly reducing CRP levels over just 8 to 10 weeks. What we eat every day truly has such a massive impact on our overall health. Dr. Bredesen's target level for hs-CRP is for us to be below 0.9. It's been measured that those with the highest CRP levels have up to a 75% higher risk of all-cause mortality than those with the lowest levels. It truly is a canary in the coal mine that can alert us to systemic inflammation before the fire rages for too long. Keeping our CRP levels as close to zero and our inflammation levels low allows us to heal, repair, restore, and helps us optimize our brain and overall health. I'd love to hear from you. Has your CRP lab ever come back high? What adjustments did you make to your diet and lifestyle to get it to come back down? Drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.